Hello, I'm Dr. Natalie DeMardo, physical therapist with Breaking Lines of Pressure, presenting movement screening, identifying at-risk athletes. To begin, we're going to talk about how the female athlete moves and understanding their biomechanics. Why is this so important, or why does this matter? Because female athletes with increased dynamic knee valgus, which is where the knee collapses inward, or that knock knee positioning, are at a higher risk of ACL injury. I'm going to repeat that. So, female athletes with increased knee valgus, where they have the collapsing of their knee inward, that knock knee position, are at a higher risk of an ACL injury. So this is important because research has shown that approximately 80% of ACL tears are now occurring from non-contact causes, and it's happening because of how an athlete moves. Biomechanics can be a predictor of an ACL injury. So the knee motion and knee loading during a landing tasks can be predictors of an ACL injury risk. So we want to take a look at how our athlete moves to help identify these. Some of the movement screening assessment tools that we could use are the drop jump test, single leg squat, tuck jump, and single leg balance. You can utilize a video assessment for visual feedback, corrective cues, and even tracking their biomechanic progress and improvement over time. You could utilize your phone, an iPad, anything that you have. It doesn't have to be anything fancy. So here we have the drop jump test. Your athlete is jumping down from a higher surface down to a lower surface on both legs. They're looking for a soft, quiet landing, equally landing right to left. You want to make sure that your athlete is having a lower center of mass when they land, and gravity, they're making sure that they're getting low with hip, knee, and ankle flexion. So that's that increased bending of all of those areas, getting low, nice, soft, quiet landing, as well as looking for that valgus. So where the knee is collapsing in, which is what we don't want to see in our athletes because it puts them at risk for injury. But if we can identify it early, that is key. Here we have the single leg squat. I like to start with the double leg squat just to see what their form is. And I'm looking for valgus. Sometimes if you look at their double leg squat first to compare both legs at the same time, it helps. And then here we have single leg. This video shows with a band, but you would just take out the band and look at their single leg. You would want both legs fairly equal, right to left, with good hip, knee, and ankle alignment on top of each other without that knee collapsing inward. And you want to have, again, low center of mass where they're getting good hip, knee, and ankle flexion without a lot of loss of balance. Here we have tuck jumps, bringing the knees up to the chest. Not only are you looking at how they're landing, but also how they're taking off. Again, similar things that we're looking for: nice, soft, quiet landings, hip, knee, and ankle flexion, and really trying to identify if they have that valgus, so that collapsing of the knee, either in both knees or just on one. Single leg balance, you want your athlete to be able to hold at least 30 seconds on both legs. Start with the eyes open. If that's too easy, then you can progress to eyes closed or on an uneven surface. So overall, our biomechanic movement patterns that are commonly seen in females and can increase the risk for an ACL injury. We've touched on the knees collapsing inward, so that knock knee positioning, that valgus, particularly on landing, loud, stiff landings, limited hip and knee flexion, so maintaining too tall of an upright positioning. We want to see them get low. Limited single leg balance, cutting without deceleration control, that overreaching or using the ground to change direction instead of their own muscles, poor neuromuscular control. So all of these movement patterns can put your athletes at risk for an injury, particularly an ACL injury. And these can be observed not only in the screening assessments, but also in trainings or games. Factors that we can identify and help change early with these screenings. We've touched on the increased dynamic knee valgus, that collapsing of the knee inward, upright posture, narrow base of support where their feet are too close together. We want to try to have them much wider for that wide base of support. And then also fatigue management. Your athlete might have good technique early on in the match or training, but as they get fatigued and tired, they go back to their kind of habitual poor mechanics as they fatigue. That's something to definitely keep an eye on. And research has shown that up to 50% reduction in ACL injury with neuromuscular training. So just by incorporating neuromuscular training to change these movement patterns, you have a 50% reduction in ACL injury to correct these identified at-risk movement patterns. That is huge. So thank you, coaches, for all you do. You guys have such an important role in these athletes' journey. And I just want to emphasize that you guys don't cause injuries, you don't cause an ACL tear, but you can help prevent it. So thank you for your time. I look forward to partnering with you and help keep our athletes healthy and on the pitch. Here are some resources. Please visit our website, breakinglinesofpressure.com, and our references. Have a wonderful day.